We got a socialized healthcare system for the veterans. It's just everybody else that we're worried about. So we think it is time to provide a single-payer system for all people. Now, in the healthcare bill, we fought for two things. I focused on two things. Number one was community health centers, where we had really good success. And what that's going to mean in Vermont is the following. Here's my promise to you. 7 years ago, in the state of Vermont, we had two federally qualified community health centers. One was in Burlington, and we have one up in the Northeast Kingdom doing a very good job up there. Two. We had about 6 locations. In the last 7 years, we have been working with communities all over this state, and we've gone from 2 FQHCs to 8, last one being in Springfield. Okay? We now have 41 locations. These community health centers provide excellent quality primary health care. They provide dental care. How's that? They provide mental health counseling, and they also provide, very importantly, the lowest cost prescription drugs available in the United States of America. So people can actually fill the prescriptions that their doctors write. Right now, we have 8 of these. We have 41 locations. We've got about 110,000 people in the state of Vermont accessing FQHCs for their primary health care. There are 2 areas in the state yet that we don't have them. And that one is in Bennington County, one is in Addison County, and we're also weak in southern Windham County. So my pledge to you is that we are going to work hard to expand the FQHC movement in Vermont. We're going to go from 41 locations to probably 50, 55 locations. And the day will come, because we now have the money to do it. That's what we fought for. The day will come where every single person in the state will have access to high quality and affordable primary health care. And that's not either or single payer, that's an integral part. When you have a single payer system, you're going to still need to have a delivery system. You're going to need a primary health care infrastructure, and I think that will play an important part of that infrastructure. Second area that we worked on. We said during the legislative fight of the health care reform, we said, look, we think the way to go is single payer. We don't have the votes to do that. I tried to offer a single payer bill on the floor. It was filibustered by the Republicans, and I had to withdraw that effort. But what I did try to do with some success is say, okay, listen, what happens if you have a state that wants to go beyond, better than what the federal government is doing? Now, what you all have to understand, and this is very good news, is the federal government, especially in the year 2014, is going to be pouring huge amounts of money into the states, into these exchanges. 30 million more people are going to be insured. A lot of money is going to come into the state of Vermont. In addition to that, Senator Leahy and I worked, Congressman Welch worked very, very hard to make sure that the state of Vermont was not discriminated against for doing the right thing, i.e., we have an expansive and much broader coverage of Medicaid for low-income people than any other state in the country. We're way up there. And what we said is, look, it's unfair that you have a state like Mississippi, the federal government is going to put all kinds of money to cover lower-income people, expand Medicaid, when Vermont, to a significant degree, has already done it. Don't penalize us. We want compensation, we want remuneration for that. The end result is that over a period of years, hundreds of millions of dollars is going to be coming in from the federal government to replace state money. That's a real boom to the state of Vermont. On top of all the other federal money that's coming in. What does it all mean? What it means is that we will be in better shape. What we have always said, and what I believe to be true, is that when you get rid of the private insurance companies, when you have a simple, non-bureaucratic program called single payer, you can provide health care in a much more cost-effective way than through the private insurance companies. And that's true. On top of all of that, we have a lot of federal money coming into the state. So what we said, what I fought for, is to say, look, if a state like Vermont, or any other state, California is strong as well, wants to move forward with a single-payer program, let them use this funding. Let them go forward and use the additional funds to do that. We fought to make that provision effective in 2014 when the new exchanges go into effect. We were fought very hard by all kinds of different people. And the best that we could do is get that effectuated into 2017, meaning that states will have the flexibility to use the money that's coming in if they choose to go forward with single payer. But what I want to tell you, this fight is going to continue, and I'm going to do everything I can. We're going to be soon introducing legislation with Senator Wyden of Oregon to lower that date to 2014 when the new exchanges go into effect. So the goal here is, what I would like to see is, I want to see you guys put pressure on the legislature. I want to see our strong legislature do the right thing, pass a single-payer system. I promise you, I will personally go to the President of the United States to see that we get a waiver to let the state of Vermont lead the country in a single-payer approach. That's what we want to do. Let me just conclude. Let me just read you the last two paragraphs of a letter that Kucinich, John Conyers, and I sent to people all over this country. And this is what it said. It said, "We are encouraged by the progress already garnered in multiple states toward guaranteed health care, and we will continue to work hard in Congress to clear any obstacles in the way. The 2017 date can be changed at the same time Congress considers all of the other waivers from federal laws that will be required for the state to move forward. That can happen either before or after a state passes a Medicare for All-like bill. Regardless of the legislative pass, we vow to continue to fight alongside you for health care justice at both the federal and state levels. We believe that Medicare for All is inevitable in the United States. It is up to all of us to determine when the inevitable becomes the reality." Signed, Dennis Kucinich, John Conyers, Bernie Sanders. So, bottom line is, I look forward to working with all of you, with the next governor, with the state legislature, to see that the state of Vermont is leading this country into a Medicare for All single-payer system. And when we do that, we will not only see the people of this state and our kids and grandchildren grateful for that effort, you will see the entire United States of America grateful for our leadership efforts, because trust me, if we go first, they will follow. Thank you very much.